healthcare personnel, the prime most important thing is to save someone's life, and that could be done with the help of CPR. That's the integral part of healthcare professionals, not only for healthcare professionals but also in our daily livings. It is important to know about the CPR, that is cardiopulmonary resuscitation. So, in that part, in CPR, one of the most important things is to know about the reversible causes. So, to address those, there are some points that are addressed as 5H and 5D. Today, we will discuss about 5H in CPR. Cardiopulmonary resuscitation is a technique of basic life support for the purpose of oxygenating brain and heart until appropriate medical treatment can restore normal brain and heart function. That means a state where our body is not able to oxygenate brain and heart. So, by the help of other thing, by help of our hand and appropriate medical treatment, we are providing that to restore the normal brain and heart function, and we are making sure that the circulation of blood is maintained properly. So this is the CPR. And about 5H and 5D, we can say it are the potential reversible causes of cardiac arrest. If we are addressing these causes for healthcare provider, it can improve the chances of successful resuscitation and there will be a positive outcome definitely. So, starting with the 5H in CPR. So, what are these? First is hypovolemia. Next one is hypoxia. Next one is hydrogen ion, that is acidosis. Then hypo or hyperkalemia, and lastly hypothermia. So, one by one, we will discuss. What is hypovolemia? It's a condition where there is a decreased volume of circulating blood in the body. How we can manage this? So volume is decreased. Now it could be fluid, blood, both. So there are multiple causes from a hemorrhage, internal or external hemorrhage. Blood loss can be done, can be there, and then also with excessive vomiting in case of burn, dehydration can happen. So whenever the body fluid is decreased, volume is decreased, that is hypovolemia. So due to hypovolemia, whether there is fluid is not circulated or the blood is not circulated, there is a chances of cardiac arrest. So how we can treat it? Firstly, fluid resuscitation. We have to resuscitate with fluid. We have to transfuse blood if it is hemorrhage, and then vasopressors we can give. So you have administered blood, you have done the fluid resuscitation, and still not BP is increasing. That time we have to give vasopressors or inotrope. And prime most important thing is to address the underlying cause, whether it is due to burn, whether it is due to diarrhea, whether it is due to severe blood loss. We have to address and we have to treat. So first one was hypovolemia. Next one, hypoxia. So it's a condition where the body or a part of body is deprived of an adequate oxygen supply at the tissue level. It can be generalized, affecting the whole body, or local, affecting a specific region. So our body needs fuel, and that fuel is oxygen. Whenever there is decreased oxygen or deprived oxygen, oxygen is decreased, that time hypoxia will be there. So it could be generalized, it could be local. So how we can manage hypoxia? Definitely we are telling that decrease oxygen, that means you have to give oxygen therapy. Even if the patient or the client is not able to maintain the normal ventilation, that time we can mechanically ventilate the patient. We can do the endotracheal intubation, or we can do a tracheostomy, and then we can connect the patient to a mechanical ventilator, and then we can continue this and addressing the underlying cause, why the hypoxia is happening. So basically, whenever these things we are doing, now why I'm telling I could address underlying cause first. No, it's an emergency, right? So first stabilize the person, whether it as it is decrease oxygen, so give oxygen, and then if it is not, the patient is not able to maintain the normal ventilation, then ventilate the patient and then try to find out the cause and treat. So this is about hypoxia. And lastly, targeted temperature management for head injury patients. We can know we have to maintain an optimal temperature so that the excessive utilization of oxygen won't be there. And lastly, medications, some kind of bronchodilators we can give. We can give budesonide, we can give salbutamol, we can give livolene, duolene, like that, to improve the oxygenation. Next is hydrogen ion or acidosis. So acidosis is a condition where the concentration of hydrogen ion in the blood or body fluid is too high, resulting in a lower than normal blood pH. So pH scale measures the acidity. It is normally 7.35 to 7.45. Whenever the pH level in the blood is below 7.35, that is called as acidosis. So acidosis could be two types: respiratory acidosis, metabolic acidosis. We can discuss elaborately later. So what is respiratory acidosis? Whenever due to respiratory causes, the acidosis happens. That means your body is not able to take enough oxygen and not able to exhale the excessive carbon dioxide. So body is retaining, from that acid is produced and the person is being at a state of acidosis. That is respiratory acidosis. And metabolic acidosis is nothing but when due to metabolic causes the blood pH level decreases. That time it is called as metabolic acidosis. So it's an emergency. If you are not treating this, then cardiac arrest may happen. Even after cardiac arrest, we have to find out and we have to correct the acidosis. Otherwise, there will be decreased chances of survival. So how we can manage this acidosis? Addressing the underlying cause. Definitely, first you have to do an ABG. You have to find out whether this is respiratory acidosis or this is metabolic acidosis. Next is buffering agent. So what is buffering agent? This is sodium bicarbonate is the buffering agent. Bicarbonate. This is a buffer. It will help to neutralize, it will help to maintain a normal pH. Because it's an acid, you are neutralizing with a buffer. So you are giving the patient sodium bicarbonate. Then there is ventilation. With the help of ventilation, we can remove the excess carbon dioxide from our body. So that time we can correct the respiratory acidosis. And moreover, if the person is not able to maintain normal ventilation, then we can intubate and continue with the mechanical ventilation. So as I told, bicarbonate correction, there is a formula. So we can do full correction, we can do half correction. In the ABG, there is base axis. So how we can do the correction? How you will know that how much bicarbonate you have to administer to that particular person? Firstly, by body weight, approx body weight, not necessarily every time we can take a proper body weight. At least we can assess, like we can guess a body weight. So we'll guess the body weight, then body weight into the base axis in the ABG by 3, it is full correction, and for half correction, body weight into base axis by 6 will be the formula. Next is hypo or hyperkalemia. Now, what is hypokalemia? Hypokalemia is a condition characterized by low levels of potassium in the blood. Now, potassium is the crucial, very important electrolyte which is regulating the sodium potassium ATPase pump, which is regulating the muscle function, which is regulating the normal heart's conduction system. So whenever it is below 3.5, that is hypokalemia. Whenever it is more than 5.5 or sometimes it is 5 as well, that is called as hyperkalemia. Both are dangerous because from hypokalemia and hyperkalemia, both, there could be life-threatening arrhythmia happen, and if life-threatening arrhythmia happens, within fraction of seconds, cardiac arrest will happen and we may lose the climb. So what are the causes of hypokalemia? Some kind of drugs we are giving, loop diuretics, laxative, glucocorticoid. From that it may happen inadequate consumption of potassium. Sometimes too much water intake can over dilute the electrolyte level and it can decrease. Due to Cushing syndrome also hypokalemia happens because there is the adrenal gland is affected, due to which potassium will be excreted, and due to heavy fluid loss also hypokalemia may happen. So how will you manage? Orally or IV replacement as per the potassium level. So IV correction, there is again a formula. We have to do either full correction or half correction. For full correction, potassium deficit into body weight by 3. How will you calculate potassium deficit? It would be 4.5 because it's the optimum level. So 4.5 minus the potassium level of the client, it is potassium deficit. So from that into body weight by 3, and for half correction, it would be potassium deficit into body weight by 6. So that's how we calculate potassium deficit, and from that you know how much potassium will be administered. So for IV replacement, if it is 40 MEQ, then we can give a peripheral line, but it should be within a 18 gauge cannula. You have to make sure, because potassium may cause phlebitis and it will cause irritation to the patient. We should not do, and if it is more than that, 40 MEQ more than that, so it is preferable to give it by central venous line. So how will you manage hyperkalemia? Firstly, you have to stabilize your heart by administering calcium gluconate, then shifting potassium intracellularly. You are shifting the potassium from blood to cellular. Reuptake you are doing. So how you can do? By administering glucose insulin. Along with 25D, 10 unit human regular insulin you are giving. You are neutralizing that particular glucose, and then you are administering the patient, so it will help to reuptake the potassium. It will shift the potassium into the cell, and then we can manage this. Then beta 2 agonists like albuterol can also promote potassium uptake into cells. Lastly, removing excess potassium with the help of diuretics. Lastly, we can do dialysis, and also we can give potassium binder, which will bind with potassium and it will remove the excess potassium. Next is last one, hypothermia. Hypothermia is a medical emergency where the body's core temperature drops below 95°, that is 35 degrees Celsius, leading to a dangerous loss of heat faster than it can be produced. It can be caused by prolonged exposure to cold environment or immersion in cold water, or can affect vital organs, right? Like brain, heart, and muscle. And it will cause cardiac arrest as well. So how we can manage? We can give passive external rewarming by providing blankets. There are also some blankets which is medically approved. In ITU, we are maintaining those, and then active external rewarming also we can give with help of warm normal saline also. And if the patient is able to take warm beverages, we can provide the warm beverage. So these were all type of 5A's. Can recall, we have started with hypovolemia, where there was decreased volume, then hypoxia, where there was decreased oxygen, then there was hydrogen ion excess, then hypo or hyperkalemia, and lastly hypothermia. So these were all about 5A's, and in the next classes we will discuss about 5T, that are toxin, tension pneumothorax, tamponade thrombosis, and both thrombosis, that is pulmonary or coronary thrombosis. Thank you.